Well, all month long, we've been talking about colorectal cancer, and today's overriding message is that age matters. Gastroenterologist Dr. Jose Parangao is joining us now from MedStar Franklin Square Medical Center. Thank you so much for joining us.
Thanks, Elsa. Thanks for having us over.
Of course, of course. I just want to start out by talking about this change. It used to be that the screening age of colonoscopies used to be 50 years old, but now that's been lowered significantly to 45. What is behind that change?
We are finding more and more that cancers are occurring in individuals younger than age 50. In fact, in modeling data, as we've come to know and become familiar with in terms of COVID, right? A lot of the evidence points out that if we lower that starting age to 45, up to 2 or 3 cases of colon cancer can be prevented. 1 death from colon cancer can be prevented for every 1,000 patients. So that, and it actually also works out to increase the life years of individuals by lowering that starting age. So joining the U.S. Special Task Force in terms of that recommendation include the American Cancer Society and the American College of Gastroenterology.
These statistics that I'm seeing, they are disturbing. More than 18,000 people younger than the age of 50 are diagnosed each year, 45 new cases each day, and 10 per day die from this disease. So why is it affecting millennials?
But my understanding is the cutoff for millennials starts at individuals born in 1981. So if you think about it, that age group is actually coming up to that 45 cutoff pretty soon. So I think that more than anything, I think awareness of these statistics that you just mentioned and the importance of getting screened as early as possible is critical for millennials to understand that it's colon cancer is no joke. I mean, globally, it's the 3rd most common cancer in men and the 2nd most common cancer in women. And screening is our best tool to fight against colon cancer at this point, because we do want to catch them as early as possible and prevent them if we can.
And that's exactly where I was going to end with you. What can young people do now to keep from becoming a part of these statistics?
We've talked about screening, so it really is the best way to prevent it, because the earlier on we identify it and address it, the better off you are. There are certain, because a lot of patients do ask about risk factors. There's a growing body of evidence that certain lifestyle changes, such as, because, for example, red meat, the consumption of red meat, and in particular processed meats, have been shown to have an increased risk of developing colon cancer. So reducing those elements in your diet, certain other things such as obesity, defined as having a body mass index or BMI above 30, trying to get that weight down if you're in that category can reduce your risk potentially. And the usual things such as tobacco use and alcohol use all play into this. So
this is one of those things where it does come right back down to that diet and lifestyle as well. If you maintain that, you lessen your risk. Dr. Parangao, thank you so much for all of your helpful information. We really appreciate it. And of course, we want to let everyone know that they can call 443-77-2475 or go to medstarhealth.org/screenings to learn more. We'll be right back with more Midday Maryland right after this. Stay tuned.